Welcome back to OncoHub. Today we are discussing D3 lymphadenectomy in rectal cancers. The incidence of central lymph node metastasis in rectal cancer is up to 11% and with a 6% skip metastasis. The D3 lymph node is typically situated from the origin of IMA up to the takeoff of left colic artery. We start off with the peritoneal cuts immediately below the IMA. Here we are dissecting above the IMA here. We are trying to define the IMA lymph nodal packet, the central lymph node station 253. We're dissecting and defining the left colic artery here. That's the station 253 IM lymph nodal packet. It's a small template with a huge clinical impact. Now we are starting the clearance of the IMA node, and that is the IMA packet being completely cleared off. Now we're proceeding with the high ligation of the IMA. Here we do the intra-sheath nerve separation technique, where the sheath around the IMA is cleared off circumferentially before we clip the IMA. This safeguards the left trunk of the inferior mesenteric plexus from injury. Thanks for watching.